I'm sorry, there is no heartbeat. It's a phrase that 71 U.S. families hear every day while eagerly anticipating the birth of a child. These babies die at a viable gestational age and most appear to be otherwise healthy. Each year, 26,000 babies are stillborn in the United States, and doctors are unable to provide a cause of death for over 2/3 of these families. The Star Legacy Foundation is working to change that. Formed in 2005, the Star Legacy Foundation mission is to increase awareness, support research, promote education, and encourage advocacy and family support regarding stillbirth. Executive Director Lindsay Wimmer lost her son Garrett to stillbirth in 2004. This first-hand experience with the issues has helped her to lead the organization to become nationally recognized.
Star Legacy Foundation was created out of the need to turn our grief into something positive. By working with stillbirth families and friends and researchers and medical professionals, we can learn more about pregnancy loss and find practical steps for prevention. Over the years, the organization has grown to include thousands of families who also want their baby's legacy to contribute to positive pregnancy outcomes. Our champion awareness events are led by volunteers and take place across the United States. They draw together family, friends, and supporters in the local community who have experienced a loss. These events are an incredible opportunity to remember our babies and to connect locally with others who understand or who have experienced our heartache. Putting that grief to work for good provides a level of healing that you can't find in many other places.
Star Legacy supports families by providing prenatal education, peer companions to grieving families, support groups, and a phone support line.
Yeah!
Chris and Amanda Duffy suffered the stillbirth of their daughter Reese in 2014. Stillbirth families and supporters around the United States find Star Legacy Foundation and reach out to them for support, advice, and information. In turn, many of these families join forces with the organization to lend their own expertise and resources to the cause.
Star Legacy Foundation, we really believe in what they do because they provide a voice for children that we have lost, children that don't have a voice. And we feel like it's one of the only platforms we have to be a voice for our daughter Reese.
If parents can educate themselves, if they can educate other people, that is their child's voice. I mean, that voice would have never happened if that baby would have been born normal and alive. That would have never happened, you know? And so I think that Star Legacy, they want to see change, and they're open to talking with people because there's a stigma that nobody wants to talk about stillborn, nobody wants to talk about a baby dying, but I think they need to.
Star Legacy also leads advocacy initiatives, including the introduction and promotion of legislation in several states and at the federal level.
Star Legacy's initial and most prominent areas of focus are in research and education. We currently have projects in development that will enhance research efforts towards determining the causes of stillbirth and appropriate strategies to identify and manage stillbirth risk factors. Unfortunately, the rate of stillbirth in the United States has remained unchanged for nearly 50 years, and recent numbers indicate that it is actually increasing.
Dr. Emmanuel Gaciano is a perinatologist and was medical director of Minnesota Perinatal Group with more than 26 years of experience delivering high-risk babies. He now works with Star Legacy Foundation to assist their efforts in research and education.
Also, what's quite important is research about the families that are affected. How does the healthcare system deal with the women who have these losses? Because it's not always optimum how we are afraid to engage their loss. And so we need to work around and incorporate ideas from the bereaved families as to where we should go with future research.
Star Legacy encourages research and education by hosting the Stillbirth Summit, where researchers from around the world come together to share their research and discuss emerging evidence.
Stillbirth Summit is an opportunity for us to contribute to research, provide education to caregivers, and support stillbirth families. I'm always encouraged by the energy and the collaboration of these events. The researchers, health professionals, and stillbirth families have so much to teach each other and learn from each other.
Star Legacy is a community for all touched by the 26,000 babies that are stillborn every year in the United States. Those who support Star Legacy provide care and community to those grieving a stillborn baby, help unlock answers to these shocking losses, and provide education to medical professionals, which can then, most importantly, help save lives of future babies. You can find out more by visiting us at starlegacyfoundation.org.